Hey guys, I hope you guys are doing great. So today we have a very special person. She's gonna share a story with us. So we have Nomgcobo Vika, but we know her as, I don't know if I should tell the people what we call you.
You can. Let me take this off because actually it's like glaring here.
Alright, it's cool. It's cool. Sorry, I just have to keep my messages on. So I think they're still busy. Alright. So we know her as Vuvu. Nah, I'm not sure you're okay calling you Vuvu for the rest of this talk. Is it fine?
Yeah, it's okay.
It's fine. Okay. So Vuvu, can you please tell us about yourself, maybe anything you'd like us to know?
So yes, like you said, my name is Nomgcobo Vika. I'm a fifth year medical student here at the University of Pretoria, and yeah, man, I think that it's a very awkward question to ask someone. Like,
I know.
What do
I also don't know how to answer such, but it's fine. Yeah.
So yeah, tell a little bit about myself. I consider myself as free spirit. I'm a free spirit, and I'm a very disciplined person, or I try to be disciplined, and I'm very big on family. So yeah, that's me basically.
What do you say in terms of your discipline? Because I can. You never told me that before, but I know really you are. What do you mean when you say you're very disciplined and things like that?
I mean, like, I think I'd say I'm disciplined in the sense of when it's time to get things done, I will get things done. And when it's time to play, then okay, fine, I can play. But I'm not gonna lie, I do procrastinate. It's one of my problems. I'm like a heavy procrastinator.
Yeah.
But I've been trying to cut that down. So I'm trying to be, disciplined in my studies, disciplined in my personal life also. And I think people tend to lack here and there. But overall, I think that I'm very disciplined. And I try to get things done when things need to be done, or in advance, so that I don't have that, before the deadline and then you are shaky.
Yeah, like us.
Yeah.
Like us. We used to be shaky now. So, do you know maybe when you decided, I want to study medicine, what caused it for you personally?
So growing up, I had this cousin and they would always call her Dr. Vika, Dr. Vika, Dr. Vika.
Yeah.
So she was supposed to be the only doctor in the family because everyone referred to her as Dr. Vika. And I think it was a thing of they were trying to manifest it into her life. Sure. And then it's like, again, the rest of us, we're not manifesting anything. They don't want anything from us. So, I think that there was that. I'm not gonna lie, there was that jealousy to be like, what about me? Why can't I also be Dr. Vika? And then I always I've always been in love with helping people. I've always been a caring person. So I've never seen myself doing anything else. I always saw myself being in health, anything in health. I think, growing up, I didn't really know exactly what, because you're only told that there's a doctor and there's a nurse. That's the things in health.
Yeah,
you didn't know about physios, OT, radiographers, you didn't know about those things. So I was like, okay, fine, it's either I'm going to become a doctor, I'm going to become a nurse. Because I'm not a numbers person. I'm not a super books person. I know it's very funny to say that, even though we're studying something that's so hectic. I'm not a super book person.
Even now?
Even now, I will chop the books.
You push cause, man.
I will chop the books when I need to chop the books, but I'm not someone I'm not a heavy studying person. So so then I was like, medicine seems like it's something that's very practical and you get a lot of exposure from it, from undergrad. So then I was like, okay, cool, let's maybe see this medicine thing. So then I fell in love with it, but along the way I actually wanted to be a marine biologist. Yeah, I wanted to become a marine biologist because I love the ocean.
Okay.
I love the ocean. I was born in PE, so that's one of my favorite places to be, by the ocean, just to smell that fresh sea air. It's something else.
Back in the day, I remember with such a careers, I think. things like that. And I saw a career of a chef. And that's all I wanted in terms of marine. I just wanted to be in the marine #1. And then just the chef salary is like, it's easy to cook. I'll just chop it up. And get paid.
I also wanted to become a chef. I used to love watching like Master Chef, Food Network, all those shows are like mine. And then I fell in love. I'm good at cooking. I'd say I'm good at cooking, but I don't like cooking. So I mean, I like even now I'll cook like once a week.
Sure.
And that's enough for me because I don't like standing. Cooking requires you to be standing for a long time.
Yeah, ne?
And you also kitchen.
It requires you to be patient.
Yeah.
Something you're not. But anyway. Okay, can I ask, do you remember what grade was this? Maybe. Was it still when you're still in school where you decided I want to do medicine and things like that?
I decided like a long time ago that I wanted to do medicine. So when they were telling my cousin Dr. Vika thing, we were like, Buma, 8 years old, 10 years old. So it's still like a primary school thing. And then also in high school, I sort of changed. I was like, now I'm going to go into marine biology. And then I think maybe around grade 9, grade 10, I still wanted either marine biology or medicine. And yay, the marks from that community.
How did you do in terms of, if you mind, like you don't have to say the marks, but how did you do in terms of grade 10, grade 11, grade 12?
I'll be very honest. I'll be very honest because maybe there's someone who needs it.
Sure, that's true.
And is trying to push and get into, medicine, and they're not the smartest person. So I mean, I wasn't an A student. I was like not in the middle of the class, but that 75, 65, 75. One of that part, yeah. You're not at the bottom. You're not in the middle, you're not at the top. That part there. So I was like around there, I used to chill there, easy, steady chilling. And then Aisha, science, Nemet.
Like do you think you were giving it your all in terms of high school and things like that? Like where you some of us, we didn't think there's competition with regards to medicine. Mm-hmm. So when you were in high school, whatever, you actually like pushing?
Not so much, not as much as I wanted to. I mean, like, had I been able to tap into my potential back then, I think I would have done much better. And when you don't really pay attention in class, or there was no one at home to help.
Sure.
Or it was difficult because I mean, like, my parents they are like BCom people, so they were BCom people, and science wasn't really like their thing, or that trigonometry, all those things. So I only started tapping into my potential, I think, when I used to go for like extra classes in grade 12. Actually, I started extra classes in matric.
Okay.
And that's where I was like, okay, these things are not, they always say that something it's not difficult, it's challenging.
Sure.
So I was like, okay, cool. I'm starting to grasp these concepts, and it's a pity that I only started to grasp them when I was in matric, and then that's already too late for you to grasp it. So had I been able to tap into that at an earlier age, going into high school, then I think I would have done way better than I did. So, I mean, I finished matric. I had 4 distinctions, but the modules
that's expected from me. That's really expected from me. I'm not really surprised, but yeah.
So I mean, like, but in terms of getting into medicine, I wasn't gonna make it because I knew that it wasn't in science, it wasn't in maths.
What were your 4 distinctions?
How did I do? So I got a distinction in Afrikaans. So Afrikaans.
Yeah.
And it's funny because I went to a word school.
Sure.
So I got a distinction in Afrikaans.
Okay,
I got a distinction. I did business. So I got a distinction in business. Distinction, obviously everyone gets a distinction in LO.
Not everyone. Don't make us don't make us feel bad. Not everyone. I know I did it, but yeah.
Yeah. What was it also? And life science. Yeah, and life
Nice.
science, yeah.
Sure.
So obviously then the ones that they really want you to they look at in medicine is your maths and your science. Those are like the ones. And I didn't get distinctions in that. I think I got like a 60 something in physics and like I finished with like a 50 something in maths. So I mean, I'm not gonna say it was expected, but because like I said, I only started to grasp the concepts very late, you know, beginning of matric, and already things are moving so fast. Jiggy, it's
matric
June
is-
exams, then it's prelims, and then you're writing finals. So I was like, okay, no, it's okay, I understand. But yeah, so that's why that I wasn't gonna apply for medicine. I didn't apply for medicine because I knew I wasn't gonna get in.
Sure.
You know, but like you're competing with people who got 100% in physics and stuff. So I was like, no, ma'am, I'm not getting in there.
I understand. Right. So what did you apply for?
So in matric, I applied. You know, obviously you apply for a bunch of varsities. So decided that no, the marine biology way is not for me because there's no like jobs in South Africa are very scarce. It's very difficult. You know, it's a difficult market to enter into. And so then I applied for nursing. I think with every varsity I applied for nursing, and then my second choice was, I think it was international relations. Yeah, I think most of my second choices were international relations, and I think I went for education somewhere. One of the varsities I went for education.
Yeah.
As a second one. So I was like, okay, fine, you know, if it's not going to be medicine now, maybe it'll be medicine later. So let's try the nursing route because Vela, I've got the caring part, you know, tick. I love life science, I love health, tick. So what's the next better thing to do? Let's go into nursing and see how nursing is. And then I did a shadowing program, so in matric. And I was like, okay, hospital environment, I love working in the hospital. I'm not a sit down desk person, you know, typing the whole week.
Can I just do you what were you shadowing? Who were you shadowing rather?
Oh, so I went
Nurse, doctor.
Yeah, I went to Medtalks and I was shadowing the nurses there.
Okay.
So we worked in casualty. And I was like, this is cool. At least, you know, you're working side by side with a doctor, but it was only for like a week, so you don't really get the full experience of the job. And then I was like, okay, this is not so bad. Let's try it because it's still in health and I enjoy it. You know, there's that rush you get from being in the field, basically.
I understand. All right, so you get accepted for nursing, right? Which year was this, by the way?
So I matriculated in 2016.
2016. Okay.
2016. So my first year was in 2017. So I did my shadowing in 2016, and yeah. So basically, my journey was applied for nursing at a bunch of varsities, then decided that no man, let me stay close to my parents. You know, for these 4 years, I'll stay close to my parents.
Are you happy about that?
I actually am. I actually am because I'm such a nyadefa, so it's easy for me to just go home.
That's cool.
So I was like, no, it's okay. I'll stay here for these 4 years, grow, because I'm still a child. I finished high school I was 17 when I finished high school.
Nice.
So 18 in first year, I was like, I am still a child. Imagine I'm all the way in the Western Cape, or you know, far from home. So like, okay, no, it's fine. I'll enjoy these 4 years, and then after that, peace out. I'm leaving my place. I'm going somewhere. Like I'm going somewhere else. Yeah, I'm leaving Pretoria because I can't stay in Pretoria my whole life. Sure. So that's always been the plan. You know, do undergrad or do my degree, and then leave Pretoria.
Okay. So what changes along the way? Okay, what happens along the way from nursing? What happened actually?
So first year did nursing in 2017, and that was great. Yeah, so that was great. It was nice. You know, you almost do the same things as what we do in medicine. So you do your anatomy, you do your physiology, and it was, I'm not gonna lie, it was like challenging because anatomy is anatomy. I think
Yeah.
regardless of
Yeah.
you're doing medicine,
Anatomy
you're doing physio, anatomy is
It's true.
anatomy. Yeah.
Sure.
So anatomy was, it was anatomy, but I actually enjoyed it so much, and I enjoyed my anatomy, I enjoyed my physiology, and then you do also your nursing modules. I enjoyed that also, and then also working in the hospital. So with nursing, you start in the hospital like March.
You guys they work you all the time.
March, they just throw you in there.
Yeah.
You in the wards, you are working, and I enjoyed that because you got a lot of practical experience very early on in your degree. I mean, like earlier than other people get. Some degrees don't even do practicals. And then when are you there to your third month in varsity, or your second month, because you started like February, so like your second month in varsity, and you were thrown into the hospital. So then throughout my first year, there was always these nurses that would say, "Hi, but when you're always so interested, you like sitting in the doctor's rounds and everything. What do you want to do?" I'm like, I'd love to do medicine, because with nursing, you really have to have a passion for it, because you are with the patients all the time. I mean, like doctors, yes, you do see patients, but with the nurse, your whole shift, you're with the patients. And I just wanted to tap into that potential that I knew that I had. So I'm not saying that people in nursing don't have potential. However, in my heart, I'd always just wanted to be a doctor. And doing my practicals made me realize that I would like to be a specialist one day. So
Nice.
if the medicine route didn't work out, I was probably going to become like a specialist nurse, and then keep on trying. But I knew that I wanted to always work in the hospital, because that's where I get a rush. That's where I see myself working long term, not at a desk wearing high heels to work.
Yeah.
And a pencil skirt. Like, no, that's not.
You want to get into the.
Yeah. So
Alright.
then I did my first year. Then the nurses would be like, "No, dude, you must apply." It's actually quite funny how many nurses will actually tell you that, "No, apply,
Sure.
go and do medicine, go and do this."
Hmm.
Because nursing is also very demanding.
Yeah.
It's quite a demanding job to do. Emotionally also, it's very demanding. So you really need to be a strong person to be able to do it.
Yeah.
And so the point where I realized that I didn't want to do this anymore was like I'm changing nappies and stuff, changing nappies. And then I was holding a bedpan full of, feces. And I was like, no. I don't want to do this for the rest of my life. I can't do this for the rest of my life. And then I applied. So I applied in 2017.
You're still doing your first year?
Yeah, I still doing my first year. So I applied in 2017. I applied at Medunsa. Because I was just like, let me just throw it out there. I applied at Medunsa. Medunsa didn't take me. Okay, cool. And then moved on, did my year. And I made sure that I passed very well, because I enjoyed the modules I was doing. So I passed very well. Then 2018 I did my second year. Second year, I think was still moving, you're still doing practicals, and then also your other modules. And then I decided that actually I said to God, I was like, listen, this is the last time I'm going to apply within this degree. If I don't get in this year, I'm just going to finish. I'm going to finish it, and then I'll apply maybe afterwards. I'll finish it, then I'll work and apply afterwards. But there was this fear of, if I finish this degree, I finish this 4 years, then I do ComServe, that's 5 years, and you start making money, you've got bills to pay, and then life just
carries on.
For
you, sure.
Then you're like, how am I going to get the time to go back to school? Because then you have to pay for your own tuition. You're not going to be working full time anymore. So how are you actually going to survive? So I was afraid of that hey, I'm just going to end up losing my passion and losing what I wanted to do, because I'm trying to pay bills, and adulting is adulting. So I was like, this is the last time I'm going to apply. And then I applied at Stellenbosch. I applied at Stellenbosch, Medunsa, and UP. So UP, I did the internal transfer and waited. And then I got a rejection from Stellenbosch. I got a rejection from Medunsa again. And then UP was like, I was allowing.
Yeah.
Come through. Because, I mean, I had really good marks.
Nice.
I went to, the academic merit evening.
Sure.
So that was like for 80% and above, like an average of 80 and above. So I went to that, so I was like, okay, no, they clearly UP see my potential.
Yeah.
And then that's how I got into medicine.
Yeah, that's really nice. That's very nice, eh? So how's it going so far? You also mentioned that you want to specialize. What do you want to specialize in, and why maybe did you choose a specialty?
I've always been interested in obs and gynae. So obs and gynae was me going into medical school.
You don't want the rest.
I was
it's fine. It's fine. No, I'm not. You don't want. You just want to work. But you said you like working.
So I'd always, going in. I was like, I'm gonna become an obstetrician.
Sure.
Yeah, I'm gonna become a gynae. It's cool, we're delivering babies, we're doing Caesars, gynae here, all those things. And right now, I'm not married to anything. I've got a love in surgery. In surgery, I've got a bit of love in medicine. So I don't know where life is going to take me. But so it's either, I think I'm more leaning towards the surgery route because I also fell in love with ortho during 4th year rotations. Sure. That was very interesting for me. I like, things that make sense. Things that make sense, you can see on the x-ray that this is a fracture. Easy. You go, you fix it. And then the medicine route, it
internal medicine.
Yeah, okay, not like, hey, internal medicine now uses something else. But there is like something interesting about it because, there's a beauty in having a patient come in and they present in a certain way, and then you as a doctor can sort of deduce and you're like, okay,
sure, this
is heart failure. And then to also see a patient improve, that's what I also love. Internal medicine, it's very challenging because you have to think very broadly. You can't just think it's one way street. It's a highway. There's a lot going on, and that's the challenge intrigues me. But then again, remember I said that I'm not a books person. I'm not a books person. So that's what I'm afraid of. Same time I said that
you push. If you're not a book person, what are we? Hey, don't answer that. Don't answer that. You'll tell me when we shut this thing off. So what would you tell someone who'd like to also maybe pursue medicine from high school level? Someone who's doing their undergrad, might be a different one. What maybe advice you could share with them?
I would say that if you know what you want, then go for it. I mean, the worst thing they can do is reject you. And if it really is in your heart that you want to become a doctor one day, but you don't have, the marks for it, or you think you don't have the marks for it, then maybe you could go another route. I mean, there is that that VITS program. So you could do that route, do something, do an undergrad degree and somewhere like in like a BSc or one of the health fields. So you can get an idea of, I'd say rather in one of the health fields, so you can get an idea of, is a hospital life for you? Can you manage patients? Are you going to be able to see someone die in front of you? Are you going to be able to manage a person that's bleeding and the blood is just squirting? So if you're not able to do that, then
might not be for you.
Yeah, it might not be for you. But then at least you've allowed yourself the opportunity to go and try it out, to go and see if it's for you or not.
Yeah.
So don't think that just because you didn't pass well in grade 11 or you didn't do well in matric that you can never make it. Because the way that our intelligence is created, can I say graded?
Yeah.
Through like through all these assessments. So does it mean that just because in that test I didn't remember the answer or I couldn't take it out now,
Sure.
but then it might be that as I leave the exam venue, it comes in, it comes out. So pursue what you want. If you know what your dreams are, then by all means go and push for them, because you never know where you might be. You never know where you might end up, and things might turn in your favor. And you don't ever want to live life with regrets, regretting I should have applied.
Yeah,
What if, you don't living life with what ifs. It's a dangerous thing, because what if this happened? What if I applied and I became a top specialist? What if I applied and I did this and I got to save lives and I got to do this? So you'll be living with a lot of what ifs, and then you're gonna regret it, and it's gonna affect you mentally and emotionally. It's gonna affect you, because we are holistic beings. So go and push for what you want. And if you decide that it's not for you, then at least you've tried it. Afford yourself that opportunity to go for what you want to do in life, because you don't know where you're going to end up.
Yeah, that's great. That's great. I think that is it, ne? So yeah, again, I'd like to thank Uvuvu for coming to agree to do this talk. I mean, she says she's not a book person, but yeah.